All set then?
Yeah.
Here's something that's going to make you a little lightheaded.
In anaesthetics, I use lubricating gels in a range of procedures and pieces of equipment. For example, endotracheal tubes, laryngeal mask airways, nasopharyngeal temperature probes. I also use them on fibre optic bronchoscopes, and I use them for lubricating transesophageal echocardiography probes before putting them down the esophagus. I use lubricating gel to aid passage of these disposable pieces of equipment across mucous membranes.
So here's the one that puts you off to sleep.
It makes passing, for example, endotracheal tubes more straightforward, but when you're using two bits of plastic equipment rubbing against each other, it's almost essential to use lubrication in order to put the equipment into the correct place. It also causes less pain and discomfort to the patients. There's less bleeding from mucous membranes, and the patients are more comfortable after their operation. To prepare a temperature probe, I need the 12 French general purpose temperature probe, sachet of jelly, clean swabs, clean surface, and gloves. If I take out the 12 French, what I need to do is lubricate the tip of the probe to the length of the patient's little finger. I take out the sachet, extrude the jelly onto a swab, take the probe, then lubricate the tip of the probe with sufficient jelly to aid its passage through the nasopharyngeal passages, but not too much, to be deposited in the patient. In a gel, we'd like a clear solution, so we know that if it's contaminated or not. It has to be the same properties both at room temperature and in the body. And the viscosity has to be such that it's easy to manipulate, but not too thick so that it sticks to the patient or the piece of equipment. I have here a size 8 endotracheal tube that's been cut already to 26 centimetres. In order to lubricate it, I could use either a double-wrapped 5-gram tube of gel, sterile on the inside or out, a 5-gram tube of gel, or a 5-gram sachet. I'm going to use the sachet. I'm going to open it and extrude the gel onto the cuff and use the swab to apply the gel all over the endotracheal tube and remove excess gel from it. So, fibre optic bronchoscope goes down the tracheal lumen of the endotracheal tube, and when it comes to the curve within the pharynx, it won't pass any further. So if I take it out, lubricate it along its length with some gel, and try again. Round the corner and where I want to be. We use sterile sachets of gel, and that's to make sure that we don't transfer any infection or secretions from one patient to another, and also so we don't introduce any infection from gels that have been lying around for some time, opened, and then transfer them into the airways or esophagus of a patient. Single use is very important to avoid transferring infection from one patient to another or contaminating the solutions with secretions from another patient. So it was a bit short. That's in good position. 2 and 4, please. I have here a size 4 disposable laryngeal mask airway. And in order to lubricate it, again, as for the endotracheal tube, I could either use a double-wrapped 5-gram tube of gel, a 5-gram tube of gel, or a 5-gram sachet. As with the endotracheal tube, I'm going to use the sachet and apply the gel to the reverse side of the laryngeal mask that glides over the mucous membrane. I'm going to spread the gel over the back of the laryngeal mask, removing the excess and the tube, and leave the laryngeal surface clear. I'm using water-soluble gels because I want them either to be absorbed or removed from the patient and not left as a crust on the bits of equipment that I use. I'm also would rather not use oil-based solutions. These can be left in the patient or cause damage to the plastic and equipment and the coatings of the bits of equipment that I use.
Yep, that's fine.
I wouldn't use gels with lidocaine. It's not necessary, it adds to the costs and provides no added benefit to the patient. It doesn't reduce the pain or discomfort after an operation, and its duration of action is only a few minutes.